My name is Mitchell Kilkenny, and I am the tobacco prevention specialist for our local public health in Douglas County, Oregon. And so I'm certainly thrilled to have you on today and to talk about this new task force, which we are very, very excited about.
Great. Yes. And I'm Brian King. I'm director of the Center for Tobacco Products at the U.S. Food and Drug Administration, and appreciate the time and interest today.
Excellent. So tell me a bit about this task force. How did it come about? How did it start?
Yeah, so this task force is something that I think we've been working towards for many years. And so tobacco product regulation in the United States is relatively new compared to other regulated products. Congress gave us authority to regulate tobacco back in 2009. And so about 15 years. We're still in our adolescence compared to some other things like therapeutic products that have been regulated for over 100 years. And so with that authority in 2009, we've been working very systematically over the past decade plus to build a foundation for enforcement and compliance. And so we have regularly engaged with all of these entities, the alphabet soup of agencies, including Department of Justice and Customs and Border and Alcohol, Tobacco and Firearms and others. But now we're at a critical juncture in the history of tobacco product regulation, particularly enforcement and compliance, where we feel that there's an opportunity to more formalize that engagement and to ensure interagency coordination at a higher level, and not just one agency to another, but multiple agencies at the table to really think through a comprehensive approach, given that shift in the environment, including the rise of e-cigarettes, and importantly, the focus on illicit importations and making sure we can prevent that into the United States.
What's been the typical trend that you've seen over the last 1 to 2 years as far as the importation of illegal or vape cigarettes, other types of products like that?
Yeah, so I'll say that the e-cigarette landscape is incredibly dynamic. So many public health factors move from like months to years. When it comes to tobacco product landscape, you're talking weeks to months. And so we have several rapid response surveillance mechanisms, including retail sales and other intelligence gathering, where we can monitor what's happening in the marketplace. And that said, we've seen a shift within the past couple of years, particularly the product devices and types. Several years ago, pod-based systems, cartridge-based e-cigarettes were the most commonly sold. And now we've seen a shift to disposable products. And those are particularly popular among kids, flavored and disposable varieties. We've also seen several players emerge both in terms of domestic and international. I'll say in the United States, in terms of foreign owned manufacturers are about 10% of the market. The other remaining are US-owned manufacturers, most of which do outsource the manufacturing to other countries, most notably China. But that said, it's a continually evolving landscape. But for the most part, the bulk of the products are manufactured in China, but it varies as to whether it's actually Chinese-owned versus American-owned. And we've seen more introduction of Chinese-owned products within the past couple of years.
Okay, so it sounds like you're saying that most of these products are manufactured in China, although they do have American owners who are sort of funding them and importing them into the retail environment. But we're seeing sort of a shift in terms of more Chinese-owned manufacturers creating these products in China and then importing them.
That's correct, but it's still a small minority of the market share. And I think that's a misperception that many have, is that these are Chinese-owned companies that are flooding the market, when the reality is it's probably less than 10% of the market. The vast majority are US-owned companies, which have some components and parts that are manufactured internationally, but ultimately are US-based companies.
So what does it look like when they import these products, like from where it was to where it's going to be? Kind of how is that going to change?
Yeah, so I'll say that in the United States, there's various players that continue to monitor the marketplace, and that includes the FDA. And of course, we work closely with Customs and Border Protection. So we have staff from FDA, but also from CBP, which is the shorthand we use for Customs and Border, at all of the ports. And so we monitor what comes in. We have what's called import alerts, where we can put products on what we call the red list. And that gives us the ability to detain those products that are accurately reported according to the filings when they reach the port. That said, most bad actors aren't going to accurately acknowledge that they're trying to bring an illicit product into the United States. That said, the red list only goes so far. We continue to update that list, including with new products and their progeny, like, Elf Bar is one product that has since branched out into other brands. And so we're able to monitor that. But ultimately, what we are seeing is people that are misdeclaring products. And so recently we did a joint operation with Customs and Border at LAX Airport several months back, and we seized $18 million worth of products. And that's where we actually went in and opened boxes, as opposed to just looking at the import alerts. And based on that seizure alone, we found that 99% of the product that was seized was misdeclared. And so ultimately, this misdeclaring requires a lot of resources, because you got to go in and you got to open boxes, and it also involves specific authorities. And so our colleagues at Customs and Border Protection have those authorities, and that's why we work closely with them. But ultimately, it's a coordinated approach. First, we want to prevent it from happening in the first place. And so we have those import alerts. And there's also a deterrence factor as well, where people don't try knowing that things are on the list. But we also couple that with joint operations, including the recent seizure. And there will be more of those where we physically go in, open up the boxes, find product, and then destroy it or otherwise send it back, depending on what the specific violation is.
Yeah. Can you talk a little bit more about what goes on with the disposed products? So, personally, in my local community, we have a huge problem where we have lots and lots of vape devices found in our schools, and these schools don't know what to do with them. And the reports or the information that I have been given is this idea of we got to dispose of this properly, using environmental quality protocols, and these things aren't particularly easy to dispose of. So if you're having $18 million worth of product, how are you disposing of these products properly? And that must be a big cost as well.
Yeah, so there's certainly a high level cost at that large scale. And that's something that depends on what the specific violation is. Sometimes the government will cover those costs, and sometimes, depending on the violation, the entity that had the violative product is responsible for disposing it. That said, at the individual level, it's a lot easier. There's household hazardous waste facilities all over the country. Most of those are free to residents. And so the best way, if you've got e-cigarettes, whether you're a school that's collected products over the school year, or you're a parent, or you're someone who wants to appropriately dispose of these products, they shouldn't be put into the regular garbage with everything else, because we know there are hazardous components to these products. But if you bring it to a household hazardous waste facility, you can Google it as the easiest way. And most communities have those at the local level, and you can drop them off there. That's the typical approach that's handled at the lower scale. But at the higher government scale, we do take action, but it's going to depend on the violation. But in many cases, it involves either government bringing it en masse to a hazardous waste facility, or requiring the company that had the products to do so. And in most cases, the government will witness the destruction to ensure that it's actually occurred.
Excellent. And so it sounds like the destruction is happening in the U.S. and not sent back for this.
It depends on the specific violation. And so in some cases, we do send things back to the point of origin. If it has entered into the country, and again, depending on the specific operation, that could happen. But the instances where it would be destroyed, that would happen domestically after it entered the port. But there's also many instances where we prevent things from entering the U.S. market and then send it back to where it originated. So it's a combination, but depends on the merits of the individual case.
One thing that I had a question about too was some of these illegal vape sales that we're seeing locally. So we've had several reports of these like mobile vape sales where we have minivans and things pulling up to tobacco retailers trying to sell illicit vapes and e-cigarettes. Is there a way that we should be reporting this to? Is there like a designated contact, or what are your thoughts about that? I'm sure we're not the only community seeing some of those things.
Yeah. So we regularly engage with all the states. So FDA does have agreements with all 50 states, tribes, and also U.S. Territories for enforcement and compliance. And so we're regularly doing inspections on any week of the day. We've got people all over the country who are doing inspections, including in brick and mortar, and we're also doing online inspections inspections as well at FDA. That said, we do have standard processes in place to do those inspections on a routine basis, but we also welcome any information at the local level. And so the best way to provide that information to FDA is if you email us, and we have an email at ctpcompliance@fda.hhs.gov. And the CTP is Center for Tobacco Products. So ctpcompliance@fda.hhs.gov. And we frequently use that to identify areas for future investigation, and also to identify emerging trends, which sometimes percolate at the local level. And so I can't reinforce enough the importance of that type of intelligence and kind of boots on the ground information to help inform our strategies and efforts.
And in that same vein, talking about minor sales, so we did a tobacco retail licensure in Oregon. We opted into that with Douglas County, and we found that the compliance rate was about 26%. So 26% retailers were selling tobacco to minors. I'm just curious, does the FDA have a hand in that at all, as far as that enforcement goes, or is there anything that you've looked into as far as?
Yes. So this is another area where FDA works very closely, not only with states. We do inspections for not only sales of illicit products, but also for underage sales as well. But we also engage with federal partners, including colleagues at the Substance Abuse and Mental Health Services Administration, SAMHSA, related to SINAR, which is the youth inspection arm. And so this is something that's also ongoing. I will say that it's a comprehensive approach is really key. And so first, we want to make sure we educate people on what they need to do. And so for FDA's part, we do have educational campaigns and resources and webinars, including for retailers. And this is our watch is the name of that campaign. And so I'd encourage folks, if you go to fda.gov/tobacco and go to the enforcement compliance lane, you can and look at those resources. But on balance, we do know that there are some people that even after education will choose not to obey the law. And that's why we do these inspections. And so we regularly go in. FDA has issued over 100,000 warning letters for this issue over the past 14 years that we've been in existence. Most individuals who receive a warning letter heed the law and no longer violate. And we go back in and inspect again. But if they don't, we can escalate from there. And we have issued several thousand civil money penalties to retailers who have failed to heed an initial warning letter. And we've even gone so far in several hundred instances to issue no tobacco sale orders. So if there's multiple violations, we will prevent them from being able to sell tobacco products ever again. And so ultimately, we follow the standard incremental approach. And the reason we do that is because that's what's required by law. And so the Tobacco Control Act that Congress passed is very clear about what we can do, but also how much we can charge in terms of civil money penalties and what we can do in terms of escalation. And so I'll say, it's really useful that we have continued tips as well. You can consult CTP compliance at fda.hhs.gov if you see this in your area, but also know that we are actively doing inspections in coordination with state authorities, and we're continually issuing fines as well as other more severe actions for the bad actors that choose to violate the law.
How often are you finding these bad actors or these violations of the law?
Well, we do inspections on a daily basis. And so if you go on our website, we actually have our resource. It's the Compliance and Enforcement Portal. And so again, fda.gov/tobacco. And if you go on the Enforcement Compliance arm, you can search, and we have a list of everyone we've inspected and the date. You can search by location if you want to isolate it to a specific state or a specific community. And you can geographically identify the various entities, including what the violation was. That said, there's probably, in terms of e-cigarette manufacturers, alone, as well as other products, we're probably talking hundreds of thousands of retailers, So on any given week, you're going to have violations. But I will say that in general, it is a small minority of the number of entities. And I will say that we prioritize repeat offenders for inspections. And so you're going to see, continued high rates in certain instances. But overall, most retailers are obeying the law when it comes to underage sales. But if they don't, we have these processes in place to make sure that we're identifying them. And importantly, we're escalating to actions that they'll actually heed to comply with the law.
One thing I like to do as well on this podcast is sort of like talk to our listeners a bit. So youth, young parents and teachers. So if you had to address them and talk to them about why this is so important, what might you say?
Yeah, so the bottom line when it comes to kids is that there's no safe tobacco product. They all carry risk. And that includes newer products like e-cigarettes. These products contain nicotine, which is a highly addictive drug that, in addition to being addictive, can also harm the developing adolescent brain, which continues to develop till about age 26. And it can also prime the brain for addiction to other drugs. And so this is a really critical window where your brain is developing and you don't want to assault it with any type of drug or substance unnecessarily. And that includes nicotine. And so the best thing to do if you're not currently using a tobacco product is don't start. And if you are currently using a tobacco product, including e-cigarette, it's important that you talk to your parents, talk to your teachers, talk to a healthcare provider so that they can work with you to make sure that you quit as soon as possible and prevent you from future problems related to addiction as well as other potential complications.
I was looking at some recent legislation that was thrown out in the UK, and it looked like they were looking at a gradual um, phasing out of all tobacco products, of e-cigarettes, of cigarettes and tobacco products, not necessarily vapes. But the idea would be that, if you're 13 years old, by the time that you are of age, 18, you could no longer buy tobacco products. And so the age would effectively decrease. Do you ever see that happening in the United States, or any sort of total restriction or ban on tobacco products?
Well, I'd say that different countries regulate in different ways, and it's based on a lot of different scenarios. And one is based on the laws that are in place, the patterns of use, the underlying environmental context. And so there's different things that are more appropriate at different times depending on the country. In the United States, we're very much on the front end in terms of tobacco product regulation, and we're implementing foundational rules. That said, nothing is off the table in the future, but right now, in terms of end game strategies, which is, a tobacco-free generation is one of them, we're really looking at regulating the product marketplace. And so that's focusing on things like a rule we're working to finalize around banning menthol in cigarettes, banning flavors in cigars. We're getting those foundational rules in place, including other things to regulate tobacco product manufacturers in terms of standardization of practices. And so that said, we're not yet to that point where we're, discussing these more progressive regulatory actions that some other countries could be. But that said, I think we've got a lot of important things in the hopper, including a potential proposed nicotine standard to cap nicotine in cigarettes and certain other combustible products that in the near term would have an important impact in reducing tobacco-related disease and death, but also would have a higher likelihood of ultimately being implemented in the long run, given our current regulatory context in the United States. And that in most cases, any type of regulatory action requires a rulemaking, which is many years in terms of development, or an actual law passed by Congress. And so, of course, we know with tobacco, it's a fairly contentious topic for which there is rarely agreement on the Hill, but there's certainly possibilities. But I would say our focus right now is really on those product standards and addressing the product landscape and continuing to work to get illicit market products off the shelves as opposed to something like a tobacco-free generation policy.
Yeah. So it's also my understanding that nicotine pouches, things like Zyn, Ono, other brands, aren't regulated at this point in time. Is that true?
No, that is incorrect. They are regulated. So FDA has authority over these products. We've actually issued several compliance actions, including for Zyn several months ago, including for underage sales and also for unauthorized products as well. So we do have the authority over these products. We do regulate them. I think one area where the misperception might be that as a part of US regulation, companies with new tobacco products have to submit an application to the FDA, and we're required to review that. And we determine if they can be authorized for marketing in the United States. That said, when we ultimately implemented this authority, we were deluged with over 26 million applications for e-cigarettes alone. And so we're still working to get to a point where it is a pre-market paradigm. That said, we're in that juncture. I'm hopeful we'll get to a point where we are through all those applications and we then review them within 180 days, which is what Congress initially intended. That said, we do do have some products currently on the market that are not authorized. And so an example of several nicotine pouches, we have not authorized those products specifically, but they may be being sold. That said, there's no safe harbor for these products, and they're subject to enforcement action, which is what we've done, including for underage sales, as well as for illicit sales for recent nicotine product pouches within the past couple months.
What does that FDA approval process look like for these new nicotine pouches and these new brands? It's certainly worrisome that we see these brand new products that, in my mind, aren't particularly well tested. We do not know the long-term health effects, particularly brand new, and there's lots of commotion saying these products are like safer, the safest product you can have. From my standpoint, we don't have the data to know one way or the other. So what does that sort of process look like?
Well, and that's why the pre-market review paradigm is so important. And so as part of that process, a company, unless your product was on the market before a certain date in 2007, we consider that pre-existing product. And so you don't have to submit a new application. So anything from 2007 onward, which is basically every e-cigarette. Once you submit that application, it's then reviewed by a wide variety of disciplines. So we have several hundred staff in our Office of Science, and they're reviewing these applications for everything from epidemiology to toxicology to social science to environmental health, even in engineering. We have folks around, the product characteristics, and we really look at that product to make sure that the benefits outweigh the risks. And that's the standard that Congress has given us. And so other regulated products, Congress has given safe and effective, that the application has to prove that the product, like a drug, is safe for people to use, but also effective to do what you want it to do, treat a specific outcome. Of course, we couldn't have that for tobacco products because there's no safe tobacco product. And so they gave us appropriate for the protection of public health. And so we have to weigh the benefits versus the risks of that product to the population as a whole. And so as part of that scientific review, we've got dozens of scientists that review all of the different aspects, and then we collate that information and make a determination around whether the benefits outweigh the risks. And so in the case of an e-cigarette, the risks are typically youth use and initiation. We know that particularly non-tobacco flavored products, particularly candy and fruit, are really popular among kids. And so we haven't authorized any products that fit that mold. But on the opposite end, we know there's a potential benefit if an adult smoker were to use these products to transition completely from a cigarette to an e-cigarette. And so if the applicant is able to demonstrate that their product successfully helps people, adults, transition, and they do that in a rigorously scientific manner, and they also show that the product is low appeal to kids, that's the recipe to get authorization. And so for e-cigarettes, previously up until today, we're now at 27 authorized e-cigarettes, but we've also denied millions. And that's because they haven't met that scientific bar. And it's really important that we have that scientific bar so we can assess and say, listen, the product is not safe. We're not saying it's safe and we're not approving it, but we are authorizing it for sale based on the scientific evidence. And we've documented that the benefits are going to outweigh the risks. And it's also not an authorization in perpetuity. If the algorithm changes and we see an increase in a product, or we see that it's more prolific among youth, we can then rescind those authorizations, again, based on the science. And that's why that data-driven approach is so important.
Yeah. I think one of the issues that I've seen with this is that if this were really a product to help you quit smoking or harm reduction, right? Typically, you would find it from a doctor's office. You'd get it in a pharmacy. You'd get it in a place where it's like, okay, here's how you can quit this harmful thing, maybe for a slightly worse or slightly maybe better thing. Still bad for you, but still, a little bit better in terms of that. But we can find these things anywhere: convenience stores, grocery stores, where retail markets, everywhere. They're accessible. And so to me, that's like, okay, well, is this really a product to help you quit if you can find it anywhere in the grocery store? Or is this really, again, more of an incentive for youth to start using, and we're just improving the ease of access for our kids?
So in response to this question, it's important to consider the context of regulation of these products in the United States. And again, I didn't write the laws, but I'm responsible for implementing them. And so what Congress has told us is that there's two pathways where you can regulate an e-cigarette product. One is the therapeutic lane, and that would be for a cessation device. And so presently, there's been no e-cigarettes authorized or approved through that mechanism. And to get approved through that mechanism, they've got to demonstrate safe and effective. And then they can be FDA approved for the purpose of cessation. And currently there's 7 FDA approved medicines, including, 5 nicotine replacement therapies, and they've gone through that lane if you want to make a therapeutic claim. If you don't make a therapeutic claim, Congress has required that to go through the tobacco product lane, where we review that appropriate for protection of public health. And they've prescribed that we have to weigh the benefits and the risks on the population as a whole. And so that's what we do in terms of the application. We're not approving it. We're not saying it's safe, but what we have said is that it's authorized for marketing and can be legally sold. And the reason is because the entity, the firm, submitted evidence showing that adult smokers actually do transition. And we know that that can be a net benefit for an adult smoker. We know there's risk for any product, but e-cigarettes as a general product class are markedly lower risk than a conventional cigarette. And so if they transition completely, there'll be a benefit. But we know there's a lot of people who aren't transitioning completely. And so dual use is not good. But ultimately, based on the regulatory structure that Congress has prescribed, we are authorizing the products for sale. And we use that scientific standard of appropriate for protection of public health. And we're working to get to that environment where we only have those authorized products that have undergone that rigorous review, and we're moving the illicit ones off. But when you've got a marketplace of 27 million products and limited resources, you got to prioritize. And that's why this new task force with the all government approach and really inoculating resources and people in a really comprehensive way is going to be key, because it's an unprecedented issue, an unprecedented landscape that requires an unprecedented solution.
I think that pretty much wraps everything up. I just want to appreciate you for the time. Is there anything else that you would want to tell the listeners of our podcast or share with us that we maybe haven't covered?
Yeah, I mean, the only thing I'd reinforce is that, the Center for Tobacco Products at FDA, we have a dedicated staff of over 1,000 people that are working tirelessly, including scientists, to make sure that we are implementing what Congress has required to us by law. But I'll say we're not the only cooks in the kitchen. And so it's really important to consider all of the players. And that's not just at the federal level, including Department of Justice and Customs and Border, but it's also at the state and local level. And I can't reinforce enough the importance of state and local action. Federal law does not preempt states and localities from acting. And indeed, there's many things that states and localities can do that FDA can't. Things like taxation and smoke-free laws, those things that aren't even our authority, but we know from our toolkit of tobacco prevention and control over many decades are very effective. And so bottom line is it takes a village. It's not any single entity that's going to meaningfully address this issue. It's a comprehensive approach at all different levels, which indeed has been the hallmark of tobacco prevention and control for many decades, whether it be, taxation in the 90s, smoke-free in the 2000s, age of sale in the 2010s, flavored restrictions in the 2020s. The evolution of tobacco control has always included action at multiple levels that have galvanized up after we've built evidence-based and important learnings at the state and local level. So keep up the important work at all levels. We've still got some work to do, but I'm mindful that we're making important progress and we can ultimately make further inroads together.
Excellent. Well, thank you so much, Brian. I really appreciate you and your time. Thank you, Jim, for making this happen.
Great. Thanks. Good to chat with you. Have a good weekend.
You as well. Take it easy.